I want to talk to you about a book available on Amazon called Self-Tests for Dementia. I have permission from the author, Peter Yexley, to reproduce some of the content in this video, so you can try the self-tests at home. Why should you do this? Being concerned about whether you, a loved one, or indeed friend, might be on the verge of developing dementia is completely natural, especially as we age. While many of us experience the occasional senior moment, forgetting where we left our keys, blanking on a name, or momentarily losing track of what we were doing, it's easy for these slips to trigger deeper worries, particularly if we have friends or family members who have been diagnosed with dementia. The challenge lies in distinguishing between normal age-related forgetfulness and the early signs of cognitive decline that could indicate dementia. The big question becomes, how do we know whether these lapses in memory or focus are just harmless episodes or early warning signs of something are more serious? We need to try and understand so-called senior moments versus dementia. Senior moments are a standard part of the aging process and happen to people of all ages. These are typically fleeting instances of forgetfulness or mental fuzziness that are frustrating but not disruptive to everyday life. For example, and I must add, even young people experience this, walking into a room and forgetting why you went there, misplacing your glasses or phone but being able to retrace your steps and find them, occasionally forgetting someone's name only to remember it later. Let's get this straight. These minor memory lapses are okay and can be linked to stress, fatigue, or the brain's natural slowing with age. While they can be frustrating, they typically don't interfere with your ability to live independently or manage daily tasks. Now, on to dementia. This baddie involves more severe and persistent cognitive impairments that go beyond simple forgetfulness. It affects memory, thinking, reasoning, and the ability to carry out daily activities. Dementia-related issues are more frequent, severe, and disruptive. They can include consistently forgetting recent events or conversations, getting lost in familiar places, difficulty managing finances, making decisions, or following instructions, repeatedly asking the same questions or telling the same story, unaware that you've already done so. Can we recognize dementia in ourselves? One of the most significant challenges in detecting dementia is that it often develops gradually, and people may not recognize the changes in themselves. This is partly because early symptoms can be subtle and mistaken for typical aging. Also, as dementia progresses, it can impact a person's ability to understand or acknowledge that they are experiencing cognitive decline. This is known as anosognosia, where a person is unaware of their memory problems. However, in the early stages, some individuals do notice changes in their cognitive abilities, and this self-awareness can prompt them to seek medical advice. Early signs that might prompt concern include increasing difficulty in planning or problem solving, trouble finding the right words during conversations, forgetting appointments or essential dates more frequently, struggling to keep track of multiple tasks, or becoming easily confused in previously manageable situations. Okay, family members, friends, or colleagues are the first to notice signs of cognitive decline. They might observe changes in your behavior, mood, or memory that you don't see yourself. These observations can be critical to the diagnosis process, as outsiders may be able to detect patterns that the person experiencing cognitive decline may overlook. What should you do if you're worried? If you are concerned about your memory or cognitive abilities, it's essential to take those concerns seriously, but not to panic. Occasional forgetfulness can be perfectly normal, but speaking with a healthcare professional is a good idea if you notice recurring issues that interfere with your daily life. Here's what you can do. 1. Track your symptoms. Keep a journal of your memory lapses or cognitive difficulties. Note the frequency, duration, and impact of these episodes. Are they becoming more common? Are they affecting your ability to function normally? This information will be helpful if you decide to consult a doctor. 2. Consult a doctor. A healthcare provider can perform cognitive tests and evaluate your overall health to determine whether your symptoms might be related to dementia or another condition. Remember, many other factors such as stress, sleep disorders, medications, or nutritional deficiencies can cause memory problems that are treatable and reversible. 3. Involve loved ones. Family and friends can provide valuable insights into whether your memory and cognitive abilities have changed. They can also support you emotionally and help you navigate seeking professional help. 4. Adopt brain-healthy habits. Whether or not your concerns are validated, practicing habits that support brain health is always a good idea. These include staying physically active, eating a healthy diet rich in fruits, vegetables, and whole grains, maintaining social connections, challenging your brain with puzzles, learning new skills, or reading. Detecting dementia early can be difficult because the symptoms often overlap with normal aging, stress, or even depression. While we may not always recognize the signs of dementia in ourselves, several tools and tests like those mentioned earlier, such as the Minicog or SAGE tests, can help identify areas of concern. However, these tools should be used as a starting point, not a definitive diagnosis. It's natural to be concerned about cognitive health, mainly if dementia runs in your family or if you've noticed changes in your memory, but it's important to recognize that occasional forgetfulness doesn't automatically signal dementia. Many people experience memory lapses, especially as they age, without developing any severe condition. The key is to remain vigilant without becoming overly anxious. By paying attention to your cognitive abilities, involving loved ones, and seeking professional advice when needed, you can address your concerns and take steps toward maintaining long-term brain health. Remember, early detection and intervention can make a significant difference in managing dementia if it does arise. So don't hesitate to seek help if you feel it's necessary. There is no single test that can definitively diagnose dementia, including Alzheimer's disease. Instead, diagnosis is made through a comprehensive evaluation that examines various aspects of a person's health and cognitive function. This process involves ruling out other potential causes for symptoms and taking a holistic view of the individual's medical, neurological, and cognitive condition. Let's dip into some DIY tests for dementia. We'll call the first test the Quick 6. For the first test, you'll need a partner to read your questions, or you can read the questions for your partner. The questioner needs to write down the score for each question. At the end of this session, add up the score to give you a total of 28. So, you've got your pen and paper. Now, you need to find a random unknown address. Before you begin, the questioner must create this random address of 5 parts. The important thing is that it must be an unfamiliar address with 5 parts. For example, 1 Billy, 2 Wright, 3 33, 4 The Avenue, 5 London. So, you've got your pen and paper. In the book, numbers in square brackets denote the 5 parts. The example is 1 Billy, 2 Wright. So this is any first and last name. 3 is a house number, and 4 the street name. Finally, 5 is the town. So, you have a full name and address in 5 segments. Remember, the questioner writes down and reads out the name and address. Let's assume you are the questioner. Clearly read the name and address you created to the person being tested. In this case, it is this example, Billy Wright, 33, The Avenue, London. This is a verbal test, so the answers must be spoken. Armed with this name and address, recite it to your partner. Ensure you are speaking clearly. Ask the participant to remember it. Next, You move on to a set of 6 familiar questions. 1. What year is it? The score for the correct answer is 0, and the score is 4 for an incorrect answer, 2. What month is it? The score for the correct answer is 0, and the score is 3 for an incorrect answer, 3. Without looking at a clock, what time do you think it is to the nearest hour? The score for the correct answer is 0, and the score is 3 for an incorrect answer, 4. Count backwards from 20 to 1. Score 0 if there are no errors, 2 if there is only one single error, or 4 for 2 or more errors. 5. Recite the 12 months of the year in reverse order. Score 0 if there are no errors, 2 if there is just one single error, or 4 for 2 or more errors. 6. What was the name and address that I gave you earlier? Score 0 if there are no errors, 2 if there is just one single error, 4 for 2, score 6 for 3 errors, 8 for 4 errors, and 10 if the name and address are entirely wrong. What's the score, and how do you understand it? If the score is 0 to 7, there is no sign of memory problems. If the score is 8 or 9, there is some evidence of memory problems. See your doctor as soon as possible. If the score is 10 to 28, there is a higher level of evidence of memory impairment. See your doctor as soon as possible for further investigation. Simple word tests can be an effective and accessible way to detect potential memory problems. These tests tap into the brain's ability to recall and categorize information, helping identify any cognitive challenges a person might face. By evaluating how quickly and accurately someone can retrieve words from their memory, early signs of memory impairment or cognitive decline can be revealed. Now for the word recall test. Our brain is a vast warehouse that stores our life's memories. It is divided into departments and files. Throughout our lives, we accumulate a vast vocabulary. Storing words and their meanings in different departments, this information is typically accessed effortlessly when we communicate, allowing us to use words fluently without pausing to think about their definitions or associations. However, if someone struggles with word retrieval or confuses similar words, it can indicate that their memory or cognitive processes are experiencing difficulties. Imagine a little man inside the huge warehouse and you ask him to go and fetch a name, but he rushes of but it doesn't seem like he's coming back with the name anytime soon. Let's look at word recall and memory problems. Problems with word recall are often early indicators of memory issues, which can range from mild cognitive impairment to more serious conditions like dementia or Alzheimer's disease. When someone struggles to remember familiar words or frequently uses incorrect or unrelated words in conversation, it may suggest their brain is having trouble accessing stored information. Additionally, if a person finds it challenging to recall familiar categories of objects, such as animals, fruits, or colors, it can signal that their cognitive functioning is compromised. Focus on word association tests for memory detection. One simple method for testing memory and cognitive function is this word association test. It focuses on recalling words from specific categories, which requires the brain to search through its stored knowledge and quickly retrieve relevant information, just like asking the little man in the huge warehouse to find and deliver a word. Responses' speed, variety, and accuracy can indicate the health of a person's memory and cognitive processes. Here is a standard word association test that can be used to detect memory issues. 1. Animal naming test. Ask your partner to name all the animals they can think of in 1 minute. What it reveals? This test evaluates verbal fluency and the brain's ability to retrieve words from memory quickly. A healthy brain typically can generate a long list of animals in a short amount of time. Difficulty developing a variety of animal names may indicate slowed cognitive processing or memory recall issues. You could conduct a similar test, this time naming fruit. Ask your partner to name all the types of fruit that they can remember in 1 minute. What it reveals. This test functions similarly to the animal naming test, but focuses on a different category. It assesses both memory recall and cognitive flexibility, how well the brain can switch between different types of words in the same category. Interpreting results. While these word association tests are simple, they can be surprisingly revealing. A person without cognitive impairment can usually name 12 to 18 animals or fruits within 1 minute. If an individual struggles to name even a handful of items or experiences, long pauses between responses, it may indicate underlying cognitive issues. Additionally, patterns of word retrieval can also offer insights. For instance, repeating words. If your partner repeats the same word multiple times, this could suggest difficulties with short-term memory. Off-topic words. If someone names objects that don't fit the category, such as listing non-animals during the animal test, this could point to confusion or impaired executive functioning. Limited variety. Naming only a few items, despite knowing many more, may highlight slowed thinking or diminished mental flexibility. It's important to note that one poor performance on these tests does not automatically mean someone has dementia or another serious condition. Stress, fatigue, or even temporary distractions can affect test results. However, consistent difficulty across multiple attempts may warrant further evaluation by a healthcare professional. Additional word-based tests. Beyond the animal and fruit naming tests, there are other similar exercises that can also help detect memory problems. Letter fluency test. Ask your partner to name as many words as they can that start with a specific letter E, G, S in 1 minute. Category fluency test. Ask your partner to name all the objects in a particular room, such as a bathroom, living room, shed, etc., or all types of vehicles they can think of in 1 minute. Why these tests work. Word association tests engage multiple regions of the brain simultaneously. They require memory recall, language processing, categorization, and mental flexibility, all essential cognitive functions. When a person struggles with word retrieval, it may be because the brain has trouble accessing these interconnected systems. For this reason, healthcare professionals often use simple word tests to screen for memory impairments, particularly in older adults. These are the next steps if issues are detected. If these word recall tests reveal potential memory issues, it's important to follow up with a more comprehensive cognitive assessment. Cognitive decline can have many causes, some of which are reversible, like vitamin deficiencies or medication side effects, while others may be related to more progressive conditions like dementia. Early detection through simple tests like these can lead to timely interventions, improving the person's quality of life and slowing the progression of memory loss if it is linked to a severe condition. Test results research has shown that healthy individuals typically score between 20 and 25 words in the allotted time during word recall or fluency tests. This range is considered normal for individuals with well-functioning memory and cognitive processes. These individuals can easily retrieve words from their memory and quickly organize their thoughts, reflecting healthy brain activity. In contrast, a person experiencing memory problems or early cognitive decline OCAN scores significantly lower, usually between 10 to 15 words within the same time frame. This lower score could indicate difficulties in memory retrieval, slowed cognitive processing, or issues with organizing thoughts. The brain may struggle to access stored information, which could be a sign of mild cognitive impairment, dementia, or other neurological conditions. Additional factors to consider. While these scores provide a general guideline, it's important to remember that individual performance can be influenced by several factors, including age. It's normal for cognitive processing to slow down slightly as we age, which may result in slightly lower scores. Education level. People with higher levels of education or a larger vocabulary may score higher. Meanwhile, those with less formal education may naturally score lower without indicating a problem. Fatigue or stress. These factors can impair cognitive function, leading to temporary dips in performance. If someone consistently scores lower than expected, it's important not to jump to conclusions. Instead, it's a sign that they might benefit from further cognitive testing or a medical evaluation to rule out any underlying causes. In conclusion to this part, simple word association tests are an effective and easy way to spot potential memory problems. These tests can provide early clues about cognitive decline by assessing a person's ability to quickly and accurately retrieve words from memory. Whether you're concerned about your memory or that of a loved one, these exercises can be a helpful tool in detecting early signs of cognitive impairment. However, it's essential to remember that these tests are just one part of the puzzle, and professional evaluation is necessary for a definitive diagnosis. The clock drawing test. This is one of the most effective and widely used at-home tests for assessing potential memory problems or early signs of cognitive decline, including dementia. It's a simple, quick tool that can help determine whether an individual may be experiencing difficulties with memory or cognitive functioning. This test is commonly administered by general practitioners, GPs, and dementia specialists as part of a broader assessment. Although it is not a definitive diagnostic tool, the clock drawing test can provide early indications that further investigation may be necessary, particularly if the results suggest cognitive impairment. Its simplicity and accessibility make it a useful initial screening method for anyone concerned about their own or a loved one's memory. How to perform the clock drawing test at home. The clock drawing test is straightforward and can be performed using only a blank piece of paper, preferably a 4 size to give the person enough room to draw freely. Follow these steps to administer the test. No points. If the numbers are out of order, misplaced, or clumped together in an inappropriate section of the clock, no point is awarded. 4. Did they draw 2 hands on the clock? 1 point. The clock must have 2 hands, an hour hand and a minute hand. Both hands should be distinguishable in terms of size, with the minute hand typically being longer than the hour hand. No points. If the person only draws 1 hand or no hands at all, no points are given. 5. Do the hands on the clock show the correct time you asked them to draw? 1 point. The hands should be placed correctly to show the specific time that was requested. For example, 3 o'clock. Both the hour and minute hands should be positioned accurately, reflecting the time given. No points. If the hands are not placed correctly, are pointing in the wrong direction, or do not represent the given time, award no points. Dementia clock test results. Once the test is completed, the total score is calculated by summing the points from each criterion. The maximum possible score is 5 points. The interpretation of the score is as follows: 4 or 5 points. Normal score. A score of 4 or 5 indicates a normal performance. This suggests that the individual likely does not have significant memory or cognitive issues. However, if there are other concerns about memory or behavior, it's still a good idea to consult a healthcare provider for a more comprehensive assessment. 3 points or lower. Concerning score. A score of 3 or less may indicate cognitive impairment, which could be an early sign of dementia or another memory-related disorder. A low score should prompt further investigation, and it's important to consult a doctor for more thorough diagnostic testing. Other cognitive assessments, such as the Mini Mental State Exam (MMSE), may be recommended further to explore the nature and extent of the impairment. If the person scores poorly on the clock drawing test or has ongoing concerns about memory or behavior, seeking professional medical advice is crucial. A healthcare provider can conduct more detailed assessments, including blood tests, brain imaging, and additional cognitive tests to determine whether there is a significant underlying issue like dementia. A healthy individual with no cognitive issues should be able to complete the clock drawing test quickly. They should draw a properly shaped circle, position the numbers in the correct order and spacing, and place the clock hands at the designated time accurately. However, when someone has memory issues or cognitive decline, the test often reveals several problems. The circle may be poorly drawn or unrecognizable. The numbers may be placed out of sequence, or some may be omitted altogether. The clock hands may not be positioned correctly to reflect the given time, or a person may confuse the length or placement of the hands, for example, drawing both hands the same length or placing the hour and minute hands incorrectly. These errors can signal problems with spatial awareness, memory, problem solving, or the brain's ability to process information and execute tasks, all of which are key cognitive functions that can be affected by dementia. The clock drawing test is valuable because it engages multiple brain areas. To complete the task, the person must use memory, recalling the correct number placement and clock structure, executive functioning, planning and organizing the task in a logical sequence, motor skills, the ability to draw numbers and hands accurately. Because dementia affects these cognitive areas, the test is often effective in detecting early signs of decline. While the test alone cannot diagnose dementia, it is a red flag that further testing or evaluation by a healthcare professional may be necessary. Why the clock drawing test works. The clock drawing test is valuable because it engages multiple brain areas. To complete the task, the person must use memory, recalling the correct number placement and clock structure, executive functioning, planning and organizing the task in a logical sequence, motor skills, the ability to draw numbers and hands accurately. Because dementia affects these cognitive areas, the test is often effective in detecting early signs of decline. While the test alone cannot diagnose dementia, it is a red flag that further testing or evaluation by a healthcare professional may be necessary. When to seek professional help. If the clock drawing test results are concerning, such as consistently misplaced numbers, failure to draw the clock hands correctly, or difficulty completing the task, it's essential to seek medical advice. A doctor can conduct more comprehensive tests and assessments, such as blood tests, brain scans, or cognitive tests to explore other potential causes of memory problems and provide a more precise diagnosis. There are some additional considerations. While the clock drawing test is useful, it's essential to consider other factors that may affect performance. Stress or anxiety can sometimes impair a person's ability to complete the task, leading to skewed results. Vision problems or physical limitations, such as shaky hands or poor eyesight, could also interfere with drawing ability. Educational background. People with less familiarity with clocks or formal education may naturally struggle with the test, even without cognitive decline. In conclusion, the clock drawing test is a simple and practical tool for detecting possible memory or cognitive issues. Why the clock drawing test works. The clock drawing test is valuable because it engages multiple brain areas. To complete the task, the person must use memory, recalling the correct number placement and clock structure, executive functioning, planning and organizing the task in a logical sequence, motor skills, the ability to draw numbers and hands accurately. Because dementia affects these cognitive areas, the test is often effective in detecting early signs of decline. While the test alone cannot diagnose dementia, it is a red flag that further testing or evaluation by a healthcare professional may be necessary. When to seek professional help. If the clock drawing test results are concerning, such as consistently misplaced numbers, failure to draw the clock hands correctly, or difficulty completing the task, it's essential to seek medical advice. A doctor can conduct more comprehensive tests and assessments, such as blood tests, brain scans, or cognitive tests to explore other potential causes of memory problems and provide a more precise diagnosis, there are some additional considerations. While the clock drawing test is useful, it's essential to consider other factors that may affect performance. Stress or anxiety can sometimes impair a person's ability to complete the task, leading to skewed results. Vision problems or physical limitations, such as shaky hands or poor eyesight, could also interfere with drawing ability. Educational background. People with less familiarity with clocks or formal education may naturally struggle with the test, even without cognitive decline. In conclusion, the clock drawing test is a simple and practical tool for detecting possible memory or cognitive issues. High blood pressure, diabetes, or other chronic conditions can impact brain function, so these must be assessed to ensure underlying physical conditions do not cause symptoms. 4. Neurological examination. The neurological exam focuses on assessing the function of the brain and nervous system. Doctors will evaluate reflexes, eye movement, coordination, balance, and sensory function to rule out conditions like Parkinson's disease, stroke, or other neurological disorders that may mimic dementia symptoms. 5. Psychiatric evaluation. A psychiatric evaluation is often included to rule out mental health issues such as depression, anxiety, or stress, which can sometimes cause cognitive symptoms similar to those of dementia. Depression, in particular, is known to cause pseudo-dementia, where cognitive decline mimics that of dementia, but is reversible with the treatment of the underlying mood disorder. 6. Laboratory tests. Doctors may order various lab tests to look for medical conditions that could be causing or exacerbating cognitive decline. These tests typically include blood work to check for vitamin deficiencies, for example B12 or folate, thyroid function, blood glucose levels for diabetes, infections or inflammatory markers, liver and kidney function, electrolyte imbalances. These tests help rule out reversible causes of dementia-like symptoms, such as metabolic disorders or deficiencies. 7. Brain imaging. To get a clearer picture of the brain's structure and to rule out physical abnormalities, doctors may recommend imaging tests such as MRI magnetic resonance imaging provides detailed images of the brain's structure and can detect strokes, tumors, or brain shrinkage associated with Alzheimer's. CT computed tomography scan. This scan uses X-rays to create cross-sectional images of the brain and can also identify tumors, strokes, or brain injury. PET positron emission tomography scan, sometimes used to detect changes in brain activity, such as reduced glucose metabolism in some brain regions, indicative of Alzheimer's disease. In some cases, doctors may recommend genetic testing, especially if there is a strong family history of Alzheimer's or other dementias. Specific genetic mutations, such as those in the ApoE4 gene, can increase the risk of developing Alzheimer's disease. However, genetic testing is not typically a standard diagnostic tool unless the patient is younger or has a strong family history of early onset Alzheimer's. Doctors also evaluate how cognitive impairment affects the patient's ability to manage day-to-day tasks. This includes assessing whether the individual can manage finances, maintain personal hygiene, navigate familiar environments, and complete everyday activities independently. Declining function in these areas is often a key sign of dementia progression. Diagnosing dementia requires a multifaceted approach. It is not a matter of passing or failing a single test. Instead, it is a thorough assessment that considers cognitive ability, medical conditions, brain history of dementia, past illnesses, medications, and lifestyle factors. Physical condition. Assessing general health, physical well-being, and any conditions impacting memory. Neurological status. Checking reflexes, coordination, and brain function. Cognitive abilities. evaluating memory, reasoning, and other cognitive skills, brain imaging and lab tests, using tools like MRI or CT scans to examine brain structure, and blood tests to rule out other conditions, imaging, and overall daily functioning. If dementia is suspected, it is essential to consult a healthcare professional who can evaluate these various factors and rule out other potential causes of cognitive decline. Early diagnosis is crucial for managing symptoms, planning treatment, and improving quality of life. Medical history, including family. Despite these medical procedures, many people, especially as they age, worry about the early signs of dementia and wonder if there are ways to self-screen or perform basic tests at home. While these tests are not a substitute for a full medical diagnosis, they can provide insight into whether further medical evaluation may be necessary. Medical tests. Your first action should always be to consult a doctor who can carry out a series of medical tests, including blood and urine analysis, to rule out other potential causes of memory issues. For instance, memory problems can sometimes stem from conditions like anemia, infection, diabetes, kidney or liver disease, thyroid disorders, vitamin deficiencies, for example, vitamin B12, cardiovascular problems, or high blood pressure. By monitoring your health regularly, such as checking blood glucose levels if you have diabetes, or using a blood pressure monitor at home, you can identify potential issues early. These health conditions can mimic dementia symptoms, but may be reversible with appropriate treatment. Genetic testing. Specific genetic markers are linked to Alzheimer's disease. Some genes, like ApoE4, increase the risk of developing Alzheimer's, while others are directly associated with the disease. Though doctors typically recommend genetic testing only if there's a strong family history, some people may find peace of mind knowing their genetic predisposition. Armed with this knowledge, they may adopt preventive lifestyle changes like improving diet, exercising regularly, or focusing on brain health. However, it's essential to approach genetic testing cautiously. It can't predict with certainty whether you will develop dementia and should be used alongside other preventative strategies, not as a sole indicator of risk. Home screening tests. Several cognitive screening tests are available for home use, but should never replace a thorough medical evaluation. These tests assess various aspects of cognitive function and can provide clues about early cognitive decline. 1. Mental status tests. These brief exams assess memory, reasoning, language, and basic problem-solving skills. Typical tasks include recalling a list of words, performing simple arithmetic, or remembering dates and locations. 2. Orientation to date, time, and location. One simple test is to check if the person can correctly identify the current date, day of the week, time, and where they are. Struggling with this may indicate cognitive issues worth investigating further. 3. Mini Mental State Exam, MMSE. The MMSE, widely used by healthcare professionals, evaluates cognitive abilities, including memory, language, and attention. It is a standardized test that provides a score indicating whether dementia may be present. Some versions of the MMSE are available online, but a professional should interpret scores. A consistently declining score may suggest cognitive decline over time. 4. Minicog test. The Minicog is another simple yet powerful tool for dementia screening. It consists of 2 tasks similar to those explained earlier. 1. Recall. The person is asked to remember and later repeat the names of 3 objects. 2. Clock drawing. The person is asked to draw a clock, placing all the numbers correctly and setting the hands to a specified time. Difficulty performing these tasks indicates that further evaluation is needed. SAGE test self-administered gerocognitive exam. The SAGE test is designed to detect early signs of cognitive impairment. It can be taken at home and is freely available online. It assesses multiple aspects of cognitive function, including problem solving, language, and memory. FDA-approved computerized cognitive tests. Several companies are developing cognitive tests that can be done on computers or mobile devices. One of the most well-known is the Automated Neuropsychological Assessment Metrics, ANAM, designed for widespread use by the military. These tests may soon be available for home use and provide a more sophisticated means of tracking cognitive function over time. NeuroTrack is another tool that helps monitor cognitive performance over time. It provides a visual test that tracks eye movements to detect early signs of cognitive decline. Tests like this are available online and may even be covered by insurance. Their web address is www.neurotrackerx.com. Mentrax.com is an online memory test designed to measure how well a person can recall images. It's a quick and fun way to check your memory and cognitive function. The first test is free, and more can be taken as needed. A word of caution: while these home tests can provide valuable insights into your cognitive health, they should never be a definitive diagnosis. They can highlight potential issues, but only a healthcare professional can provide a full assessment and diagnosis. If you or a loved one is concerned about memory loss or cognitive decline, it's essential to seek medical advice to rule out reversible causes and get a comprehensive evaluation. By being proactive with your health and using these tools wisely, you can take control of your cognitive well-being and address concerns early on. If you or a loved one is concerned about memory loss or cognitive decline, it's essential to seek medical advice to rule out reversible causes and get a comprehensive evaluation. I hope you have found this review helpful. Feel free to share it with your family and friends.